Anna. I can see it's now 7:38, and as we had agreed, we'll be starting the forum immediately and end up on time. And then those who will be joining us, they will catch up. Last week we had a very successful presentation on medical and spiritual aspects of fasting. Very educative, very informative. And today we are reverting back to reproductive health. And Daktari will be presenting more on teenage and also have a brief recap of where we had left 2 weeks ago. And without much ado, I would like to take this opportunity to welcome Daktari to proceed. Karibu sana Daktari.
Asante. Good evening, everyone. Sorry, I'm not in a very well lit place. I was on the road, and the time. I just got held up with time. So, and I'm sure I can see you can't be able to see me well. So what I'll do, I'll just shut off my camera, then we continue talking. At least if I'm sure that will be okay with all of us.
Yeah, that is in order, Daktari. Do whatever you feel comfortable.
Okay. So let's continue. So matters reproductive health, and I want us to kind of recap what we had covered last time. And I think the most important thing that is coming up is especially when we talked about childhood issues. We talked about some of the diseases that can affect the reproductive system of young boys and girls. And I remember I mentioned something to do with the moms, which, if kids are not well immunized, can lead to infertility, especially in men. In fact, it's one of the causes of infertility in men when young boys get moms and they are not treated well. That means there's a probability of that leading to infertility. The other thing that is also very, very important, which we need to put at the back of our mind, is something to do with nutritional issues. Malnutrition is also contributes to matters infertility in both men and women, and also not only things to do with infertility alone, but also, okay, we talked about moms, and of course, many other diseases can lead to the same things to do with the syphilis and many of febrile diseases. And at times, this might not happen directly to the reproductive organs, but any disease that can affect the pituitary gland, which usually controls the cycles of hormones in a human being, then that also can lead to infertility and irregular cycles in our ladies. So diseases like cerebral malaria, meningitis, encephalitis, and all that, when they affect the parts of the brain that balance or that control, especially what I've talked about, the pituitary gland, then also that means matters fertility can be affected. Now, we also talked about something to do with undescended testes and what needs to be done sooner than later. And of course, we talked about the importance of childhood vaccines so that a child grows well with minimal infections, because most of the diseases that we usually have vaccines about, on, are usually viral diseases, and the diseases that usually cause febrile illnesses. Febrile illnesses, in a layman's term, is just illnesses that cause high fever in a child or in a human being. So those diseases can affect somebody negatively when it comes to fertility or reproductive or reproductive health. Now, we come to teenagers, and when we're coming to teenagers, I also would like to start with issues to do with matters, the young men. And in this particular place, we talk about at this particular time, we want to look at issues to do with trauma and torsion in the testicles areas. This means when they are playing, they can be hit. And at times it's something we call testicular torsion, just because of the way boys play around. At times you can just get twisting or tying the testicles tying up or having a knot form in them, which is usually something very critical that needs to be addressed as an emergency. When you have something we call testicular torsion, that will need to be sorted out like immediately, because that, if it's not sorted out immediately, can lead to gangrene, and that means the testicles needs to be cut off. So very, very important. When you hear a young man say, or a young child say, that they were just playing and they're complaining of severe pain and this unbearable pain, that pain is usually very, very severe. And at times they could also be sweating. And at times, because of the intensity of pain, some of them even develop vomiting. Then that's a sign of testicular torsion, and it's usually a surgical emergency. It needs to be sorted out sooner than later. Now, the other thing we need to also discuss about or talk about is something we call circumcision, the importance of circumcision to this young man, so that they can be able to prevent infections, because most often than not, even as young boys, when you have something we call trying to use a word that all of you can understand. So the tip, where the tip of the skin, where the urine, or the opening where urine is supposed to be coming out, when it's too tight, that means urine, there's always retention of urine with to UTI, urinary tract infection, and times something else we call balanitis. Balanitis is just inflammation of the glans penis. So when these things happen with continuous infection within the urinary tract infection, the urinary tract then that means because the urinary tract is a very sensitive part. It's a part that usually have mucous membrane.
Douglas.
Sorry, we have a small technical problem, but we are working on it briefly.
Oh, please do.
I think I muted Daktari by mistake.
Okay.
Yeah, you're muted.
Hello, I
Sorry,
think I
Daktari.
have unmuted myself. We can continue.
Okay.
Yes, we can proceed, Daktari.
Yes, you can hear me. So where did you mute me? Where were we? So I can proceed from there.
At the urinary infection.
Urinary tract infection. Yeah, I was saying when they're not treated well, you usually have a complication, and usually even when when you let it spread or pass, become more serious, then that means even when healing takes place, it heals with fibrosis. And fibrosis is just tightening, eh? So that means when time comes for them to copulate, they usually have issues. And that is something we would love or we would want to avoid. So, and that is why we usually advise men, when you have a UTI or any sexually transmitted disease, because of the length of the urethra, you need to make sure, or they need to make sure, that they are treated sufficiently and early enough. Otherwise, that could be one of the causes of one of the causes of infertility. And where was I going with that? I was going to the point where we try to emphasize the importance of circumcision in men. It's not only for hygiene purposes. Of course, it helps you to avoid, or helps men to avoid infections, and it also protects the women from cervical cancer, and of course even the men from cervical cancer. The smegma, when it's deposited in a woman, it can lead to irritation, which at times can also be a cause of cervical cancer. Then we talk about also all those sexually transmitted infections, both viral, bacterial, and fungal, and chlamydia, which usually can lead to infertility. Now, I would want to pause there for a minute and just ask whether we have any question. If we have, you ask. If we don't have, then we'll continue. Thank you.
Is there any member who has a question? If there is, you can kindly press the hands icon. can't see any hands icon. I think Daktari, we can proceed.
Yes, so we continue now, and this time around we'll look at our girl child. And when it comes to the women, malnutrition is number one issue of causing infertility. And of course, also the febrile illnesses, because when the pituitary gland is affected, then anything that can affect the pituitary glands. I'm avoiding to talk about tumors and things like that because some of these things you cannot be able to avoid. They happen just like that. But when it comes to infections, we can be able to do something about it, and we can be able to seek medical help sooner than later so that we prevent those febrile illnesses to cause damage to our children. Now, there's something, or this vaccine that most of us are aware of, and that is the why am I forgetting this vaccine? It's usually recommended for young girls, so that it protects them from the virus that predisposes them to develop cervical cancer. I'll tell you as we continue. I'm somewhere where it's in the dark. I'll tell you. It's just past my mind. So that vaccine, the girls get before they start becoming sexually active. So in our setup, we say they get it from between the age of 10 and 11. And at times you can even recommend for a little bit older women, only if they have not been exposed sexually. But when they have been exposed sexually and they've already gotten that particular virus, then it doesn't help them. And of course, we try to talk about things to do with menstrual disorders and also congenital malformations that can lead to deformity. We have quite a number of young girls, and the same applies to men who have congenital malformations that can lead to infertility. So, depending on where the problem is, it's usually critical for, at least for the young women, when they get to the critical age maximum of around 16 or so years, and they have not started experiencing the menstrual period or that kind of stuff, they need to go have a checkup to see whether the hormones are okay, or even they have any kind of malformations, especially if by the time they get the age of 16, 17, 18, the features of women, that is formation of breasts and the body changes that we expect because of the hormones clock turning on. If they have not started having the changes they expect, then it's usually good to have a medical checkup so that at least if there are any operations that can be done, then they can be done in time. For men, we talked about if they don't have, when in case of undescended testes, this needs to be done preferably before the age of 5 years. because past that particular time, the testes are supposed to be in a cooler environment than the other parts of the body, so that they can be brought where the temperature is right. So that's one of the things we need to do for ladies. So put at the back of your mind also all the infections we've talked about, the viral infections, sexually transmitted infections, and UTI. Though for our girls, things to do with STIs, or rather UTIs, they occur rarely, but at times they can occur frequently, especially when our girls don't use proper hygiene, because there are some bacteria that can pass from the rectum to the birth canal when on the and the urethra when they don't wipe themselves the right way. So usually the best way for them to wipe themselves is from front backwards, not from backwards front, because there's some bacteria that are usually a normal flora, or they occur normally within the rectum, within the digestive system. But when they get to the to the birth canal or to the vagina and the urethra, then they cause other problems. So very, very important for us to teach our girls how to wipe themselves and to avoid infections or infecting themselves or contaminating themselves. Yes, and of course, it's very, very important, especially when we see our girls complaining about things to do with painful menstrual periods. We take them for a checkup to just confirm that they don't have something we call they don't have malformations or seeding of the urethral tissue in other parts of the body. I'll tell you the name in a minute. Yes, so that at least they can remain healthy, and if they need to be assisted, then they can be assisted, because there's some drugs that we give them to make sure that they have a more regular menstrual flow. And finally, we can look at the other issues that affect women at that particular, as they continue growing old. Things like fibroids and how we can be able to deal with them, which can also lead to things to do with infertility or miscarriage, or yes, infertility, miscarriage, or delayed conception, because fibroids, depending on where they are growing, they can cause to miscarriage, or they can cause, depending on where they are growing, they can cause some delay or normal function of the uterus. Yeah, we've seen people who have gotten pregnant and they have fibroids, then At times it complicates during birth. That means they cannot be able to get children normally, need to have an operation done and things like that. There are others who can't be able to get children because of the same. And yes, all those kind of stuff. The other thing we want us to look at is nutritional issues relating to the same. So far, do you have any issues? Do you have any question?
Yes, Doctor, I have one question that
Yeah.
popped up. More of a clarification about the vaccine that is given to the girls and the safety. How safe is it? And being that there are so many vaccines that are given to our children, these days. How not how effective is it, but does it have side effects? And are there any worries that we should know when this happens? Because in most cases we are only told that we need to sign forms and allow that to happen as parents, but we are never told the pros and cons of such vaccines. In fact, some of them, I'm sure none of us have had them until we are told that we need to give consent. So, are there any side effects? What are the pros and cons of the particular vaccine, if any?
Thank you. Well, most of the vaccines, or rather, almost all the vaccines are made from byproducts of the viruses that they are supposed to prevent you from getting. So the way your body reacts to those parts of the vaccine or those parts of the virus will depend on how you react to that. And I'm sure when you look at it scientifically, the side effects are usually minimal compared to allowing somebody to get the disease without the vaccine. So it's a matter of trying to weigh the pros and cons. We've heard of issues that some people are saying that the vaccines have had some side effects on them. And of course, for instance, let's talk about the most common thing that happened to most of us. You remember during the COVID era, almost majority of us got the vaccines. Are we still here? Yes. Did we see people who had some side effects? I don't know. The side effects were more of the fever, the nausea, and all that. Most of the people who got, in quotes, things that were not very good could be people who got the vaccine when they already had the disease. So that now, when the body was trying to reconstitute the immunity, then a few of them succumbed, but not necessarily because of the side effect of the vaccine. I know there's so many things that were said about the vaccine, but I can tell you, like for us, majority of us, we are on the medical profession. We were kind of instructed to take it, and we did. And I'll tell you, most of my colleagues and I did it, and I don't think we really experienced a lot of. For me, I think the only thing, it could be just a 1 day kind of dizziness, and the following day you're well, which is quite normal with other vaccines. It's just like what you feel when you're taking something like a flu vaccine. So, but now when you're talking about these other vaccines to do with, like the one we're talking about, for the young girls, I don't know why I'm forgetting that name. The human papilloma virus or something like that, if I'm not wrong. Yeah. HPV. Yeah, human papilloma virus.
Yes, it is HPV, Daktari.
Yes, human papilloma virus vaccine. So, and I think it's human papilloma virus type 22 or something, or 21 or something like that, because that's the one that usually causes or predisposes women to developing cervical cancer. So when you look at it from that particular perspective, it's a recommendation. Nobody is forced to do it, but at times I've seen it's more, it's advisable to use it. But if you feel you have your own reservations, from my own perspective, I think I advise people to do it. But we've been trying to look at the statistics and the data around that. With that particular one, there have been a lot of issues, people trying to look at the pros and cons, especially in the many areas where that has been done, and trying to look at the number of people who have side effects vis-a-vis the number of women who develop cervical cancer in the long run. It's not every woman who has human papilloma virus develops cervical cancer. So at times it's a matter of chance, and we don't know who or what predisposes some more to the virus than others. So, but I know there have been a few critical literatures here and there, but as I told you, when you look at it from a scientific point of view, vaccines help more than when you're not vaccinated. Because, for instance, if you compare what used to happen in the past, things to do with measles, things to do with polio, can you compare the number of children who are getting paralyzed or sick of polio and all this kind of stuff, and what we're having nowadays? I think nowadays you don't get children with polio. We used to have something we call it was not chicken, it was smallpox, which was eradicated like in the 1980s or 1978 to be precise. Some of you, pengine hata Douglas alipata hiyo shindano and the like. I know.
Yeah, I did, Daktari.
Yes. So when you look at it from that particular perspective, the benefits of vaccines, and that is why even you heard our president saying that we would want to have our own vaccine developing factories. And that is why he heard of Cambry trying to come up and has come up with malaria vaccines. So when you look at it from that particular point of view, and also the problem is that at times we read so much data that they're not substantiated. When you look at it from a scientific point of view, then you can be able to demystify the importance of vaccines vis-a-vis staying without them. And that is why even at this particular time, I was telling you the other day, we are getting into a cold season. Imagine we are now in the month of May, the beginning of May. We are yet to get to June and July and August. So by just looking at whatever is happening now, that tells you what is ahead of us. So I usually advise people, if you can afford, please get your flu shot. It helps to prevent those serious attacks of flu when you have already gotten a flu vaccine. So that's what I'd want to advise us, so that we look at it from a holistic perspective, so that at the end of the day, yes, I'm doing this from a point of information. Do I want to protect myself or my daughter from getting cervical cancer? Yes. If I want, this is it. But the most important thing is, all said and done, if we can be able now to make sure, which is usually not the case, that we can be able to control and make sure most of our children don't indulge in unprotected sex before marriage, and when they get married, they become faithful to their partners. That's another ballgame altogether. That would be very healthy, because that would help prevent and protect them against some of the things you're talking about. But that, might not be the case. So that's why at times we look at it from all perspective, holistic approach to the same. Like I would want to tell you something I experienced and I saw. I can tell you of a very interesting scenario. One of a lady friend of mine, whom I know had kept herself very pure and holy. And in fact, she got married to a pastor. But this guy, who had trained to be a pastor before he decided to become a pastor, he had gone out there and enjoyed life properly, and he had already gotten infected with HIV. So the first night these guys went out for their honeymoon. By the time they were coming back from the honeymoon, of course, you know what would happen to a virgin when they're exposed to the virus. She didn't even last a month. So after the honeymoon, they came. The girl was very sick, took her, got her to the hospital, did the tests. Fortunately or unfortunately, she was HIV positive. When she was told she's positive, I don't know whether she died of the virus or she died of depression. So when you look at it from that particular perspective, then you understand what I'm trying to tell us. So there's so many things that we need to put at the back of our minds, and for us to be very practical and holistic in approach. And I think that is what eventually led to the recommendation of young men and women to be tested for HIV before they get married. I wish we can be able to recommend more tests than just the HIV test, so that at the end of the day, we can know that our young men and our young women are getting married to the people who they want to get married to, because the world is very deceptive, and I leave it at that. I don't know whether I've answered you or not.
Indeed, you have, in totality, in deep detail. Thank you very much.
Yes.
Yeah, could we also be having someone else who has a question so that Daktari can answer the question before he conclude? I think, Daktari, you can proceed.
There is. Kevin has a question.
Yes, I can see Kevin have raised your hand. Kindly ask your question. Kevin, ask.
Hi everyone.
Hi.
I have a question for.
Hi, Kevin.
Hi. I had a question for Daktari. I don't know if it's meant for this forum, but in terms of like for example, for a man, is it? There's a friend of mine who once was diagnosed. I don't know what that disease is, but I wanted to ask: is there a disease that is caused by that affects men, or rather, when a man does not engage in sex for a very long time? Yeah.
Okay, I don't think whether I would call that a disease, but all I know and what we have experienced in most cases is that sex usually helps the body to relax and basically reduces what we call what I'm trying to look for the best term, depression and tension, all those kind of stuff. And so, and that is why you hear like when you go to places like prisons, they always allow the spouses of the men, or those men who are, or the people who are married, to have their spouse go to visit them for their conjugal rights. But looking at it from a different perspective, and that is why at times you even hear of funny things happening in prison, things to do with sodomy and all this kind of stuff. But I've never heard of anybody getting a disease because of lack of sex. But I have heard men, and at times even women, associating some conditions they develop with lack of, what do they call it? Ejaculation. And what we've come to realize is not that is a major issue, or it's even related to sex or lack of sex or lack of ejaculation, but it's something associated with herpes genitalia, so that when they are exposed to that particular virus, at times because because of tension or stress, the lesions for herpes genitalia starts popping up, and when they start popping up, then they start having that kind of irritation, but it's got nothing to do with lack of sex. It's just because they're infected. I don't know whether I've answered you, Kelvin. And not unless you can be able to give us more details of what you had and what usually happens. But as far as I'm concerned, that is one of the thing I know, or I have experienced, that people have been trying to tell me it's associated with the lack of sex or lack of proper sex or things like that. But it's just because they have herpes genitalia, and at times it just pops up because of the stress. They think it's lack of sex, but it's not because of sex, but it's just a virus that they have within them. I don't know whether I have answered you.
I believe you have answered me, because I remember my friend also mentioned something to do with stress, and he was advised to. It was actually from considering his that time current working conditions. So I believe you called it herpes genital infection. Yes.
Yeah.
I think that was
something popped out downstairs.
Yes.
Yes, that has got nothing to do with lack of sex. It's just an infection. And usually when you're stressed, your immunity goes down. And when your immunity goes down, then the virus flares up.
Okay. Now I understand.
Okay.
Okay, thanks a lot.
You're welcome. So
anybody else? Any other question or comment or an observation? It's welcome. Yes, George?
Okay, Douglas, and I just want to thank the Daktari for this kind of an explanation. We are getting it sound and clear, and I don't think for me I have any question, but I'm happy that his explanations are getting into us very, very well, and we are happy for this forum.
Thank you.
Thank you, George, for your comments.
Okay.
Okay, James, do you have anything to say?
Not really. Just appreciation of Daktari taking up the time and the sacrifice that he has taken out of his time to give us this, to educate us on what is happening in relation to matters health. After every session, I'm always eager for the next session because it's always educative. So I feel appreciated, Daktari, and thank you for the good work.
Okay, thanks a lot, Bwana James, for your views. They have been heard loud and clear, and thank you very much. Daktari, I think you are concluding, eh? So you can conclude and I can end the session. Daktari?
Thank you. Thank you, George, and James, for the kind remarks. I appreciate. Now, I think I don't know whether I want to go into more details concerning the things we're talking about. But the only other thing, I think there's something I mentioned earlier about fertility pertaining to women. And I remember I mentioned it in passing, and we didn't talk so much about it, but I think this could have been also be a better place to mention it. Now, we talked about a condition where when a woman is exposed to sex, to many different men, her body develops some kind of antibodies against sperms. And I think I mentioned it in passing a while ago. And we said when that happens, you can think that they are infertile, but they are fertile is only that now their body have developed antibodies against sperms. And at times that could be a reason why some of them don't get pregnant. And I think this is also related. You remember the research that was done about the Majengo prostitutes, also in relation to getting HIV, where they would say even if they're exposed because of continuous exposure to HIV, they have developed, their bodies were developing some kind of antibodies that would protect them from getting HIV. So it's prudent, and I think I'm talking to men here, fortunately or unfortunately, for men to be very keen on what they engage in or whom they engage in when it comes to matter sex. So I'll leave that with you and put it at the back of your mind so that you look at the character of somebody. You might think somebody does not have HIV just because the test is negative, but they could be carriers, in quotes. So this is something deep I'm talking about, but you need to put that at the back of your mind, especially for the young men who are thinking of getting married if they're not married. You need to be very keen on the character of a person than only looking at the negativity of a test. And with those few remarks, unless somebody has a question, I would wish to leave it at that. So
I
that
I have a quick question, Dr. That has just popped up in my head. Now that
yeah,
you mentioned HIV and infection and all that,
yes.
there is a thread that was trending a while ago, sometime last week, and some guy brought up an issue about HIV, and the tests that and the tests and the testing. Now his hypothesis was that that when you go to get, if somebody is HIV positive and they go to get, and they want to do and they know that they're going to do a test, they swallow any kind of medication before, not the ARVs, but maybe like Panadol or something like that, and the chances that the results will come out negative. Now, what is there any scientific proof? Because people are really bashing the guy, and nobody knows the truth behind it, whether it is true or just hearsay. So, is there any scientific or scientific backing towards that, or is there any truth in that matter? Thank you.
Okay. As far as I'm concerned, there's no truth in that matter, because you see, even at the end of the day, the guys we've been treating for several years, they still test positive anytime we test them. And the beauty of it nowadays, you're not only talking about the antibody test. Nowadays, we're even doing the viral load. The only thing we have seen is that after taking ARVs for some time, you can be able to get to a place where your viral load is undetectable, but your HIV status still remains positive. I don't know whether I'm making sense, because now when your body has been exposed to the virus, it's just like when you get a vaccine. If we test, because now the vaccine is to trigger your body to form an antibody that will fight against that particular disease. And for HIV, that is what you usually check for, that antibody, not the virus. But now, after you've detected the antibody in the blood, then we do a viral load to see where you are. And initially, we were doing something we were calling CD4. Okay? CD4 is just some kind of white blood cells. We wanted to know the amount that you have of those particular CD4 cells. And because we knew when you had HIV, the HIV virus is attached to the CD4s, so they are destroyed. So if we did that and we saw your CD4s were quite low, then we knew we were able to know whether you have stayed with the virus for a long time or a short time, or it was an acute stage or something like that. But nowadays, even the CD4, we don't do so much, because we discovered the functions and the relationship between CD4 and the virus. But nowadays, we like looking at the virus per se. So we look at the viral particles. So when somebody says it has, okay, there are some tests, not necessarily HIV tests. When you have taken some drugs, like for instance, if you're talking like something to do with platelet count and things like that, then it can give you a false positive or a false negative. And at times it's just a count because of the nature of the drug you've taken. But I've never had and I've never seen where somebody, because and of course we see most of the people, for instance, when what we were doing a while ago, we used to test patients on medical grounds, and at that particular time amekunywa madawa, ametumia paracetamol, not only ya kumeza, amedungwa, amefanya nini, but they still used to turn positive. So I think it has no validity when it comes to saying that some drugs like paracetamol can lead to HIV negativity tests. I don't think so.
Thank you very much for that clarification.
Yes.
Okay. Thanks a lot, Daktari. I think today's session, I don't know what to say, has been so very clear, and you are very loud and clear. In terms of infertility, I have a feeling that maybe you can expound more in the next presentation, because I also know this issue of chlamydia, and maybe we can go into details as to, so that we can be able to understand really about infertility and the causes and the kind of conditions like chlamydia.
That is why I talked about, in general, about infections. I talked about viruses, and I don't know whether you want us to go through all the signs and symptoms of this kind of infections or what? Because I just talked about them in passing, but now if you want us to go into details, we can look at how we can be.
Not exactly that, but I think, I don't know that it can be also a subtopic in itself, whereby all those types of infections can be grouped together for those of us who are taking notes. Or maybe, okay, you can advise us on that.
Okay, I'll think about it and how we can be able to approach it so that anyway we can do we can do a less, or rather a session on the same. Will be the signs and symptoms of most of those sexually transmitted infections, so that at least when the young men or the young women in the group sees this kind of signs and symptoms, they can know what to do.
Yeah, that is well captured, Daktari. Well captured. Signs and symptoms.
Sawa.
Okay, I don't know whether you have concluded, Daktari.
I think from my side, I'm done.
Okay. Thanks a lot for our presentation. It was well presented, the session, and we do not take it for granted. We really appreciate your presentations and the way you answer questions, and we become more informed and educated. And someone said that information is power. So I would like also to thank all the participants for today. Some of the regular participants were not able to join us today, but we believe that because these are recorded, they will still catch up with us. So I would like to take this opportunity to thank each and every one of us, and I would wish you all a blessed week ahead. We meet next time, next week, same place, same time. God bless you all. Thank you.
God bless.
Okay, good night.
Amen.
Good night, all.
Uh-huh.
Yeah, I think now we are three of us.
Hold on 1 second.